The short answer is we are not at that point yet. We have to determine where we are as well in the communicable infection disease status. And at this point we are starting to see some movement on the other side of the curve, on the downhill side of the curve, but not to the point where we can say we're ready to relax our restrictions on surgeries.
That's a good question. As of this moment in time, we believe there's only a single strain worldwide. There have been some studies recently that have looked at the viral sequence that have shown some mutations within the genomic sequence. We're not sure what those mean yet. They're doing more evaluation of those viral strains, but hopefully, as you mentioned, these mutations will allow us to take care of the virus much easier and possibly to create new drug targets and or immunotherapies like vaccines. So that would be the hope going forward.
Well, I think the big thing to be thinking about is your health and just being healthy yourself. So sheltering in place, doing what your doctor says, going to your doctor's appointments, wearing a mask, great hand hygiene, all those things that we're hearing over and over as to what to do is what you need to be doing. The safest place for you is away from anyone who can possibly give you any type of communicable disease. So right now, sheltering in place is your friend.
I'm hearing more of the 18-month timeline. University of Washington, a little over a week ago, started enrolling their first patients in one of the early coronavirus vaccine trials. So given how we know that these studies are done normally, if everything goes beautifully well, no hiccups, no complications from the vaccine, I anticipate in about a year or so having preliminary data saying that it's effective, and then the next step of getting it ready for public consumption.
Well, I think certainly the majority of the patients that we've seen here have been in that cohort who are at highest risk. Those who are above age 60, those who have other comorbidities that predispose them to a more serious infection. Some have been outside that cohort, and we don't know exactly what the reason is that they have gotten ill, but often it's family contact, or in one case, we think the patient was infected on the job at a child care center in contact with lots of children who, as we know, may be minimally symptomatic. And that person, we think, probably got ill in that setting. But in general, it has been the typical cohort of patients who are at risk that we've seen here.
Well, I'm glad that you asked that. We have been working really, really hard to not only keep our patients and our staff safe for our patients, but also to keep that sense that this is your special time, that we want you to enjoy your birth experience. You weren't anticipating this. Someone wasn't anticipating this when they found the great news that they were going to have a baby in April or March of 2020. Mm-hmm. And instead, this has really jumbled up people's plans and what they thought, how they were going to be celebrating this amazing life event. So what we're trying to do is keep our patients safe. And so by that, we are limiting visitors. You can have one primary partner with you throughout, and then if you have a certified doula, you can have that as an additional support person through your labor, delivery, and hospital stay.
So you can safely see them now online. I would recommend that if you haven't tried Skyping or other electronic means of communicating with people you care about, or FaceTime. We've done that a lot with our son who lives in the area, but we don't want to lower our shield too quickly, and that's what I would advise you to do. I think there is frustration with social distancing, with keeping a distance, but the analogy that I've heard that I think is accurate is if you're descending from a plane with a parachute, you could say, well, this parachute seems to have slowed my rate of descent. I can probably take it off now. You really don't want to do that, and particularly with a loved one who may be at risk. So I would recommend that you not be in close physical proximity with that person, particularly if you're a healthcare provider, because we know that COVID carriers, people can be asymptomatic and still be transmissible, that incidence may be higher than we suspect. There is some recent data from states that do more testing than Washington has done, that the positivity rate is quite high, perhaps up into the 30% range in some instances. The data suggests that, so I would be very cautious about returning to physical proximity with anyone who is at risk in the near future. And that near future horizon is still uncertain. There is also some information from the Institute for Health Metrics and Evaluation from the UW that puts Washington still in a timeline of returning to more normal relaxation of social distancing and other measures in the late May region of time. I know Governor Inslee has put us at May 4th or beyond. I suspect that that date will go out toward the end of May with the new information that's coming in from where we are on our curve in Washington State.